There is a saying that when wealth is lost, nothing is lost. But when health is lost, something is lost. Distinguished ladies and gentlemen and viewers all over the world, welcome to this episode of Your Health, Your Priority. The subject matter to be considered today is the COVID-19 vaccine. I am your host, Ms. Grace Chidima Nafi Okwa. With me here to do justice to the subject matter, COVID-19 vaccine, is a young, passionate man who professionally has what it takes to do justice to the subject matter. He is a public health professional. I'm talking of no other but Mr. Angwa Israel Onahi. Mr. Israel is a public health scientist. He completed his first degree from the prestigious University of Calabar, Nigeria. He has co-authored a publication on hepatitis B in the American Public Health Journal and the Nigerian Biomedical Journal. Mr. Israel also holds over 15 certifications in health-related courses. You're welcome, sir.
Thank you very much for having me.
Alright, without waste of time, let's dive in. Mr. Israel, considering the topic of today, COVID-19 vaccine, can you briefly tell us what are vaccines?
All right, thank you very much for that question. When you talk about vaccines, they are biomedical treatments that are introduced into the human system to help fight against infections, diseases, and viruses. But in simple terms, talking about vaccines, I would say that they are not necessarily curative treatments per se, but are preventive treatments that are introduced into a human system, basically to help fight against viruses, diseases, and infections. Thank you.
You mentioned that vaccines are not necessarily curative treatment, but preventive treatment. In the light of that, can you tell us more about the COVID-19 vaccine?
All right, some years ago in 2019, we were stormed by the dreaded COVID-19 pandemic, which claimed a lot of lives, to some extent, to crumble the economy of some nations. And it was to that effect that the COVID-19 vaccines were developed. And talking about the COVID-19 vaccines, they were basically developed to help fight against the COVID-19 virus. And permit me to add that the COVID-19 vaccines are of different types. We have about 4 types of the COVID-19 vaccines. Thank you.
You mentioned while telling us about the COVID-19 vaccines that they are of different types. Can you please shed more light to that?
All right, thank you. Talking about the types of the COVID-19 vaccines, like I said earlier on, there are just 4 types of the COVID-19 vaccines for now. We have the AstraZeneca vaccine, we have the Moderna vaccine, we have the Pfizer vaccine, and then we also have the Johnson & Johnson vaccine. These vaccines perform the same function in the human system. The major difference amongst the 4 of them is just their mode of preservation for the sake of to maintain potency of the vaccines. Thank you.
Thank you for the answer. Where can an individual go to get this vaccine?
COVID-19 vaccines can be gotten from any nearby health center close to you. Just a stone throw to any nearby health center close to you, you will be able to get access to be vaccinated again. Perhaps you get to a health center and they don't offer that service. They will redirect you to the nearest health center where you can get yourself vaccinated against the COVID-19.
Mr. Israel, let me ask you very quickly, have you been vaccinated?
Yes, I have taken my own jab of the COVID-19 vaccine.
Mr. Israel, are there any benefits to taking the COVID-19 vaccine, and does an individual have anything to lose by not taking it?
All right, thank you very much. Going to take the COVID-19 vaccine is a plus to the individual in the sense that after taking the COVID-19 vaccine, your system have what it takes to fight against COVID. And you not going to take the COVID-19 vaccine automatically means that your system is vulnerable to the infection. And it's a plus to you. That is why you don't need to waste any much time. You need to go get vaccinated. Thank you.
Okay, we understand that you do have a meeting to attend to almost immediately after now. But before we let you go, there have been so many rumors and stories flying around about the COVID-19 vaccine as not being safe and all that. What do you have to say about that, sir?
Okay, talking about the rumors going around about the COVID-19 vaccine, you will agree with me that news that have some level of falsehood to some extent tends to fly very far and very wide. But to the best of my knowledge, I would say that the COVID-19 vaccines are very safe and effective to be taken by all. Like I said earlier, I have taken my own jab of the COVID-19 vaccine and I am alive. So if you say that there are side effects or you talk about happenings after taking the COVID-19 vaccines and all that, then I think I shouldn't be alive today again. But personally, I have taken the COVID-19 vaccine and I am still alive, healthy, hale and hearty. And a couple of persons have also taken the vaccines and they are very much living a life. And for me to see persons who have taken the COVID-19 vaccines, I think to some extent are even much more healthy than those who have not, because their system have what it takes to fight against the COVID-19 virus. Thank you.
In a way of summary, what's your advice to the general public regarding the COVID-19 vaccine?
Okay, summarily, I would like to say that the COVID-19 vaccines are safe, they are effective, and it is equally free of charge. You've not taken your own jab of the COVID-19 vaccine, then I think you are not helping yourself. Do well to visit a nearby health center to get vaccinated against the COVID-19 virus, because in so doing, you are helping yourself to prevent yourself from getting it, and you're also helping to prevent somebody who is nearby from getting the COVID-19 virus. Thank you.
All right, viewers, you've heard it all. Now is the time to act. Visit a nearby health center and get vaccinated against this COVID-19 virus. And always remember, prevention is better than cure. Thank you for staying tuned. See you in our next episode. Thank you.